I've been talking to Dr. Stacy Francis today about her book and telling her that I have been cutting back on my caffeine intake. I have a problem with clenching and grinding at night, and I started to realize that I was having a lot more jaw pain than I've ever had before. Like, I woke up and I had a significant amount of pain, and I was trying to think about what I could do, what was causing it all of a sudden overnight. I was reading her book and she was talking about limiting our caffeine intake. And so I was having about 400 milligrams of caffeine a day. I'd have some in the morning, about 200, and then I would have an energy drink in the afternoon because I don't like coffee. My dentist told me that I had been grinding, and I remember it was in 2014, I'd started to take caffeine every morning. I'd never had caffeine before, and I started having caffeine every day. So sometimes it would be like a green tea extract kind of thing. Sometimes it would be a Red Bull, and I just started to do it every day. And that's when I remember, and I was very stressed at that job. And I remember, after they told me that, I remember during the day, I would like notice myself clenching when I was stressed. And I started to think about that. But, you wear the mouth guard, you move forward, and, like a decade later, here I am, 2 doses of caffeine every day. I have a 4-year-old, and now I never had caffeine before. And it's almost like, do you even need it? Or is it just like this little treat yourself moment? So I decided to, I woke up with that jaw pain. It was just out of nowhere. And I said, okay, I'm thinking back to this. This all started when I started the caffeine. That's what started this. So I decided to drop my afternoon caffeine. So now I'm down to 200 milligrams. I'm just having the morning one. And the jaw pain is gone. And I've noticed too, I don't think I'm grinding as much. I have no way to know that. I'm not taping myself at night, but I can feel the jaw pain and the stress. And I have one tooth that's very sensitive, that has been a lot less so. So now my goal is to wean myself off the morning caffeine and then probably switch to like an herbal tea or bring it down, less and less and less. And then save the caffeine for once in a while, but it should not be every day I'm having this.
Right.
And how can I boost my energy in the morning without using caffeine? And it's just, you get into that cycle of doing that, and then you're up super late at night. So cutting the afternoon caffeine has been great, and so it really helped decrease the jaw pain. And now I'm working to kind of add in some of the other things.
Excellent.
So thank you so much for recommending that to me, and hopefully I'm going to be adding more changes in as I continue reading the book.